Hello, everyone. Hi, welcome to the WSBTV Facebook page, and welcome to our presentation, Questions and Answers. We're talking the COVID-19 vaccine. We are doing this today because we have a special coming up at 6:30 p.m. tonight as part of our 6 o'clock hour. WSBTV Channel 2 Action News at 6. And the goal right now is to talk to you at home and get your questions about the vaccine. Should you take it? When should you take it? Where should you take it? What's the easiest way to sign up? What's the most difficult way to sign up? You got one shot. How do I get my second? I got Moderna. Can I get Pfizer? What about Johnson & Johnson? All these legitimate questions. We want to be your source. We have an expert coming on in the next 30 seconds. We're going to talk to her. She's from Piedmont. We're going to talk to her. She's part of their vaccine group. She's on the COVID task force. She knows all these answers. And the goal is to not change your mind. The goal is to not influence your opinion. The goal here is to give you the information for you to make the best choices for you and for your family. So it is 2:03 right here Eastern Time, wherever you may be watching us. We have 1.6 million people on the WSBTV Facebook page, and we're grateful that some of you have decided to join us right now. We're in the hundreds. I may be looking down at my phone to get your questions. And then let's go ahead and bring in Dr. Jayne Morgan right now. Dr. Morgan, thank you so much for talking to us.
Thank you so much for having me today. It's my pleasure.
You know, Dr. Morgan, we're going to take some calls, so I want people to put in the comments section right down here your COVID-19 vaccine questions, your comments.
Okay.
And then we're going to answer them. But first, for the next minute, let's talk about your credentials. What brings you here? What makes you qualified to answer some of these questions with Piedmont?
Thank you. Absolutely. And it's such a pleasure to be here. As we all have worked together through this COVID pandemic, Piedmont certainly has been on the leading edge of trying to provide information to people, making certain that people understand the vaccines, that they understand the rollout. And that's part of my job, to work on providing that information. Certainly without information, our brains are very active and imagination takes over. And we want to reduce some of that information with some real facts, some real data, real science, and have you have an opportunity really to ask us questions.
And you know what? And Dr. Morgan, that's the goal, right? Because we want people to ask questions. And guess what? Dr. Morgan, you're really popular because people are already hopping in asking questions. I'm putting on my reading glasses now, and we're going to go ahead and say, here we go. I cannot seem to get an appointment anywhere. Jeanette is asking. What do you say about that?
So these are, unfortunately, that is such a common complaint that we have. And one of the things that I would suggest as we continue to open up these mass vaccination centers across the state is check with your Department of Health, but also check with your local pharmacies and local supermarkets, Publix, Kroger, Walgreens, CVS. Those are all opportunities. And if it's not in your neighborhood, feel free to drive to another neighborhood where a pharmacy is offering those vaccines.
So Martin,
and don't forget, I was going to say, just don't forget, if you are a veteran or part of the military or armed services or reservists, the VA is providing vaccines for all people with military background.
You know, and I'm so glad you brought that up because there are lots of groups, right, Dr. Morgan, going to people. Like I know an independent pharmacist who's going to nursing homes. He's going to churches with his pharmacy group. They own 10 pharmacies. I know people who are reaching out to hard-hit communities, to rural areas. So we're seeing a lot of that. Let me ask you this question from Martin, who says, I want the J&J vaccine. How can you get that? Can you actually choose the vaccine or just go where you go?
So currently, we don't have choices for the vaccines per se. That being said, different centers may have different allotments on different weeks. None of them are able to really predict as the supply comes in. And so it will really be up to you to try to identify where that is. And just because a specific location has Johnson & Johnson this week, they may not have that next week and vice versa. So we have to be prepared for that. We do not have a great supply. We're continuing to up the manufacturing. And so at this point, we are saying, please accept whichever vaccine is available to you. By and large, they are all equitable. And we want to make certain that you are vaccinated, not partially vaccinated. And we want to move our community, meaning the entire United States, up to this level of herd immunity such that we really can be protected.
Dr. Morgan, I have a question here from Sheila, who's chiming in saying she wants to know, she she still has to worry about being someone who tested positive. She tested positive for COVID at this point. Does she still need to get like another test? Or what is that? If you test positive, how far do you have to wait to get the vaccine?
So if you have tested positive for COVID-19, we are unclear how long your immunity lasts beyond 90 days. So we certainly want you to receive the vaccine before 90 days of your COVID diagnosis, and certainly if you are asymptomatic. So all people who have had COVID should also move forward with receiving the COVID vaccine beyond 90 days. It is unclear how long your native immunity will last.
Dr. Morgan, for everyone just joining us now, I want to remind everyone I'm Jorge Estevez. You're talking to Dr. Jayne Morgan from Piedmont, and together we're having a conversation for the next 20 minutes, 25 minutes. If you guys keep asking questions, we'll stay on here. We're promoting our 6:30 p.m. half-hour vaccine special we do every Tuesday here at WSBTV. We want to answer your questions, and that's the goal. And Dr. Morgan, thank you so much. You're part of the whole vaccination process, and you're on the task force, the COVID task force, so you clearly know what you're talking about. We have another question coming in. By the way, there are hundreds of you right now, hundreds of you watching this. So clearly, we're so grateful that you're here. Here we go.
Good.
So, sorry, Sheila's question was, if she's fully vaccinated, does she have to worry about being around someone who tests positive? Let's talk about that. So I'm fully vaccinated, let's say, got my 2 weeks after my last shot, the whole thing. Do I have to worry about being around someone who tests positive? What are the careful levels that need to happen now?
Right. So per the CDC recommendations, if you are fully vaccinated, meaning that you are 2 weeks out from your second dose of Moderna, 1 week out from your second dose of Pfizer, or 2 weeks out from your single dose of Johnson & Johnson. So that's fully vaccinated. It's not you received your second vaccine and now you're fully vaccinated. So make certain that you are waiting the appropriate amounts of time. Again, 2 weeks after Moderna, second shot, 1 week after Pfizer, 2 weeks after Johnson & Johnson. The CDC is recommending, I'm sorry, do you have a question, George?
No, go ahead. I have a bunch of questions. It's so exciting. Go ahead, but you finish your thought, please.
The CDC is recommending that once you are fully vaccinated, if you do come in contact with someone who is COVID positive, you do not have to then self-quarantine the way you would if you were not vaccinated. So that's number one. And so that's one of the advantages of having the immunization. If you are in contact with someone who's COVID positive inadvertently, you do not then have to quarantine because of that.
So
the other thing
go ahead.
The other thing that you can do is you can meet with other people who are fully vaccinated in an unmasked environment, both indoors and outdoors, these so-called vaccination pods, show your card and you're in. So if you got a vaccination card, maybe we can all socialize together and we can take our masks off. And then thirdly, if you're vaccinated and are visiting an unvaccinated household that is a low risk single family household, and that is for you to judge and determine if you are assessing that household as low risk. If they've been following public health measures, have been very careful, then you can go to that household, even though they are not immunized, and also remove your mask because you are immunized.
All right, Dr. Morgan, great advice right there. Really clearly put. We have a couple of rapid fire questions. They're coming in so rapidly. We're so excited.
Okay.
Brenda asks, I'm 61, very leery about getting the shot. Give me the pros and cons of taking it. We hear a lot about this, right? People are thinking, you know what? I want to wait 6 months. You know what? I may have this condition. I may be 61. I get that there are pros and cons. Which outweighs what?
Right. So one of the things that we really want to think about are these mutations that are developing. And the longer we remain unimmunized, the more opportunities the virus has to replicate and also mutate. Don't forget the Homo sapien, the human being, meaning us, we are a part of the life cycle of this virus. And without us, the virus cannot survive. So if we can remove ourselves from this life cycle, it can stop its replication and stop its mutations. The more opportunities this virus has to mutate, the less probability we have that our vaccines will continue to protect us long term. The reason for that is when the vaccines were developed in clinical trials, they are only trialed against the mutations that are available in the environment at that time. As mutations subsequently develop, it's unclear how effective the vaccines will be against these new mutations that we see coming in from the UK, from Brazil, from South Africa, from California. And so we want to be certain that we can get ahead of these mutations. At this point, we are in a race, humans against this virus, with regard to the mutations. What is happening now with both Moderna and Pfizer is that they're working to develop yet a third formulation because they recognize that their clinical trials were done at a time when some of these new mutations were not readily accessible. And so it could be that if you receive Moderna and Pfizer, you may have a third shot in your future because these mutations continue to develop. The same for Johnson & Johnson. Even though Johnson & Johnson was trialed against a lot of these current mutations, as the future rolls in, more mutations will develop, and Johnson & Johnson might be in the same predicament of having to develop another formulation to come back to provide to its already immunized people. So we want to be very careful with that.
Yeah, and I'm glad you brought that up because so many questions here and some conspiracy questions too, and some theories and some things that people are talking about that really need addressing too to some degree. But first I want to get to a couple more questions, which Heidi wants to know, when will children and teenagers be able to get vaccinated? There are trials going on right now. One of the challenges, Dr. Morgan, is getting kids, younger kids, preteens, getting their parents to allow them to take part in these trials. What do you have to say about that? Because without kids, young kids, they're like a quarter of our population. We may not be able to reach herd immunity.
Right. You're absolutely correct. And if you are 16 years old now, 16 or 17, you can be immunized right now with the Pfizer vaccine. That is the only one that is approved for 16 and 17-year-olds. All of the companies are doing what we call bridging down trials now, enrolling younger and younger cohorts, meaning groups of younger and younger people, all the way down to 6 months. We've even had a 6-month-old child already injected as a part of these clinical trials. Pfizer has already closed its trial for ages 12, I think, to 16. They enrolled 3,000 children. And so we'll be expecting those results out soon. Moderna is also working on these bridging down studies, ages 12 to 18. But you'll see that each group, each cohort will subsequently get younger and younger and younger, generally by ages of 3 years, 15 to 18, 12 to 15, 9 to 12. And as you can imagine, the younger the child is, the more difficult it is to enroll in a clinical trial, certainly one that involves needles.
Sure.
Parents don't necessarily want to volunteer their children to be stuck with a needle. So you can imagine how this can be increasingly difficult, but please stay tuned. We certainly are looking at trials with children because you are right. Children are a critical part of reaching herd immunity.
DeAndre, I want to share a story really quickly. DeAndre here commenting on our Facebook page. I took the Johnson & Johnson shot. I was sick for 24 hours with a temp of 102.3. I felt like I had the flu, but I'm better, and thank God that I was able to get vaccinated. But you know what, Dr. Morgan, DeAndre's not the only person who is saying that they want the vaccine. Others are saying they don't trust it, they're not ready for it, it's not right, it's gene therapy, there's the microchip conversation, there's all these things. Can you give us a roundabout statement that could help address some of those people who have legitimate concerns because of things they read, of people they know, and of their own feeling and gut, right? What do you say to those people?
Sure. And, what I would say is that's certainly understandable because in addition to this vaccine rollout, we're actually rolling out new scientific platforms. Instead of using live viruses or killed viruses, we're actually now using scientific agendas with messenger RNA, with viral vectors. These are all terms that people either have not heard before or have heard marginally. They don't have scientific backgrounds. It all seems, like sci-fi. And, what is really going on and what is really happening. And, by and large, as a country, we did a very poor job of communication and education ahead of this rollout. So when you look at these messenger RNA vaccines, that's Pfizer and Moderna, these are codes that once they are injected into you, they code to develop a protein in your body. In this case, it is the spike protein, which is the key area of the coronavirus that causes infection. Once that spike protein is developed, the messenger RNA denatures, it disappears. That's one of the reasons why it's been difficult to develop these vaccines because we can't keep messenger RNA around long enough.
Right.
The spike protein then stimulates the body to develop these antibodies that we need to protect ourselves from subsequent exposure to COVID. So this does not impact your DNA, does not impact your genetics. This is RNA, which is different from DNA, which I think people are getting confused when they talk about genetics.
All right, so Dr. Morgan, so many questions here I want to get in, but I want to remind everyone, I'm Jorge Estevez along with Dr. Jayne Morgan from Piedmont. We're answering your questions. It's our responsibility as a news station, as a member of this community, to answer your questions about the vaccine, to address the concerns you may have of taking it or not taking it, and help you get one. We're going to continue to ask the good doctor here how you get one, how you sign up, what's the best way. But first, I want to get to a couple of questions. Dee Dee, Dr. Morgan, wants to know, how safe is a vaccine for people with suppressed immune diseases who take drugs for these diseases that suppress their immune system? Talk about that.
And so one thing we want to say, and this is, a question that is often asked, is that in these trials, lots of people with chronic medical conditions, including those with suppressed immune systems, including those with HIV, 176 patients, were all included in these trials. So you should feel confident that if your immune system is suppressed and you're on different medications, that you can move forward with these vaccines. One thing that we are requesting or suggesting is that you certainly check with your primary care physician before moving forward. But the vaccines, by and large, by design of their clinical trials, included all types of people with all types of chronic medical conditions that included heart disease, lung disease, liver disease, HIV, diabetes, hypertension, cancers of any etiology.
That's the goal. The goal is to have as diverse of a group as possible.
That's right.
With people who have conditions.
The goal is to make certain that people who have chronic medical conditions, because you actually are more vulnerable to more complications if you were to be infected with COVID-19. For instance, I am a cardiologist. If you have heart disease and contract COVID-19, you're 6 times more likely to be admitted to the hospital. And if you're admitted to the hospital, you're 12 times more likely to die than someone with COVID-19 without significant heart disease. That goes for many of the other chronic medical conditions. So you are more at risk for a more complicated course of COVID-19 if you were to be infected. And it's one of the reasons that we want to encourage you to protect yourself with these vaccines and develop immunity, because you're more likely to be sicker and have a sicker course if you are infected.
Okay, so let's talk about helping people. By the way, something we do every Tuesday at 6:30. We do constantly in every newscast, of course, direct people to how to help people. But we have a half-hour special today at 6:30 p.m. on Channel 2 Action News at 6. Let's help people right now sign up. It's, it may be open to the entire state very soon. We've been reporting, according to our sources, not just 16 and over with medical conditions. How do we get people to sign up? I know it's a DPH website. I know there are large pharmacies. I know there's independent pharmacies. I know there's some doctors who are taking care of the sickest of their patients. What do you recommend?
So I recommend really all of those. And unfortunately, or fortunately, as this rollout continues, there is no real set course, but it will continue to open and expand and expand and expand. And I think you saw here, in Atlanta that the Mercedes Stadium was open. So keep your eyes and ears open and look for that. Piedmont in particular will be headed out into the community for some real community engagement. We will be at Ebenezer Baptist Church giving vaccinations on April 10th. We'll be at Word of Faith on April 6th. So look at your churches as well. Check with your pastors. If your pastors don't know, your pastors can certainly reach out. And we're all working to develop sort of this whole immunity together and working to engage the community and begin to meet you where you are.
All right, so Brenda is saying she appreciates the fact that we're talking about this, but she really wants this question answered. What are the side effects in taking this shot? Can we talk about some of the side effects?
Excellent question, Brenda. The side effects of all 3 of these vaccines are very similar to the flu shot. You can get chills, fever, nausea, vomiting, headache, injection site pain, injection soreness of your arm. And so these are very similar that we would have with the flu shot. These symptoms are more likely to occur or be more severe after the second shot. than the first one if you're doing the Pfizer or Moderna. So for instance, I received the Moderna vaccine, my first shot. I had a pretty significant sore arm, not enough to impede me or disable me in any way. I was able to continue to exercise, et cetera. My second shot, though, I had a headache for 2 mornings in a row that responded to aspirin. I had lower back pains. I had a fever, nocturnal, one night. None of those symptoms really concerned me. In fact, it allowed me to understand that my body was developing a reactogenicity, meaning it was revving up and forming the immune system that I need to protect myself, to reach that 95% efficacy. And in doing so, sometimes you're going to feel it. So that actually was a comfort to me to understand that my body was preparing itself to protect me and to protect those around me as well.
So there are people chiming in and commenting on this thread, which we love, the spirited conversation. We want to make sure people respect everyone else's opinions. Some people are interested in taking it. Some people have read research saying, don't do it, do it. So everyone has an opinion, and we want to create a safe space for people to express those opinions. We brought you on to just try to address some of these concerns. Tell me about the differences with J&J and the Moderna and the Pfizer. The reason why I ask those three specifically is because those are the three that are going to be out now. We know the two-shot thing with Moderna and Pfizer. The efficacy is almost the same. What do you think are the biggest differences?
So, the biggest difference, I think, and I'll tell you, it's very difficult to compare them, but the biggest difference I think that people have in their minds is you look at this efficacy number, meaning how well does it work? 94.5% for Moderna, 95% for Pfizer. But then we look at Johnson & Johnson, it's at 72%. So why would I take Johnson & Johnson? It's only protecting me at 72%. But remember what I talked about at the beginning of this broadcast is that Johnson & Johnson was trialed at a different time than Moderna and Pfizer. And when it was trialed, more virulent, stronger mutations were in the environment. These mutations were not trialed against the Moderna and the Pfizer. And so it's very difficult to compare. We're not comparing apples to apples. We're comparing apples to oranges. When we look at 72%, they actually have 100%, I'm talking about Johnson & Johnson, protection from preventing you from being hospitalized, meaning severe disease, and also death, 100%. And that is what is significant. It's incredibly significant that no one died and that no one had severe disease requiring hospitalization with the Johnson & Johnson vaccine. That's 100% efficacy from that perspective. And that's what we are looking to do, what's called that morbidity, meaning decreasing the amount of illness and suffering that our population has.
Someone on this thread, I like to address all sides of this conversation. Someone on this thread literally said, we're all being guinea pigs right now. No one really knows what's going on. So that is a very legitimate concern and a great point to make. What do you say to that?
So I think, when we talk about guinea pigs, oftentimes it's because we are not including ourselves in clinical trials. And if we are not including ourselves in clinical trials, then we can't be confident that the data that's submitted to the FDA is really relevant to all populations. When I looked at these FDA briefing documents on the data that was submitted by both Moderna and Pfizer and J&J, and I read all three briefing documents and look at the subpopulations. When I look at the Black population, look at the Hispanic population, Moderna enrolled 9.8% Blacks in their trials. Moderna enrolled 10.3%, and J&J enrolled 13.1%. And if you include Africans, it went up as high as 19%. Now, we represent 13.4% of the population, and while Moderna and Pfizer fell slightly short, it really was still remarkable at the intention and the purposefulness with which they worked to recruit Blacks into their trials. When we look at the Hispanic, the Latinx population as well, even greater, 20% and 26%, really greater than the percentage that is represented in this population. And so I think we can be confident when we talk about trials altogether that are 110,000 people, 30,000 for Moderna, 40,000 for Pfizer, another 40,000 for J&J. And we are saying for the Black population, 10 or 11% of all of those people in the trial were African American. We're talking about more than 11,000 people. When we talk about more than 25% of people in the trials were Hispanic or Latinx, these are huge numbers. And so I think we should feel confident that the representation in these trials and the data that was submitted to the FDA is relevant to our populations. I think it should hearten us to also think about whether we should enroll in clinical trials in the future and the importance of clinical trials such that we don't feel like guinea pigs, such that we know that when drugs, devices, and vaccines are developed, then the first time that we see them is not after approval. That's when we're really the guinea pigs. We have to be involved in clinical trials such that if we have side effects or reactions to these drugs, to these compounds, it is within a controlled environment with a team of physicians and nurses overseeing us.
So, Dr. Morgan, we're going to wrap up in a few minutes. We're going to take a couple of more questions here. The goal here is to talk about your questions and get you some answers and let you know that at 6:30 p.m. today on Channel 2 Action News at 6, we have a whole half hour dedicated to the vaccine, getting the vaccine, signing up for the vaccine, what you need to know. So I want to ask you this question from Robert. He says, why are the seasonal flu rates at historic lows, yet COVID deaths are claimed to be 500,000, yet infection vectors are identical? What do you have to say to that?
Yes, so the infection vectors are not identical, remember. So this virus is the SARS-CoV-2 virus, severe acute respiratory syndrome coronavirus 2, a different vector from the flu vaccine. The flu vaccines as well have an efficacy on any year between 48 and 62%, meaning how well they work. So let's think about that in comparison to the COVID vaccines that have efficacies in the 90% range. So we can expect, again, that we're not comparing apples to apples, that we're comparing apples to oranges. The reason we see a lower rate of the flu vaccine is because of our vigilance and our work in public safety and population health measures in protecting ourselves from the COVID. So what protects us from COVID, SARS-CoV-2, also protects us from the flu, wearing a mask, washing our hands, practicing social distancing, because the transmission is the same, meaning viral particles that come from our mouth and our nose. So inadvertently, the low flu rates have been a positive response to our efforts at trying to contain COVID as well.
Well, Tolu thanking us for having this conversation. I want to go ahead and thank you for doing this. What is the biggest takeaway? Let's ask you one more question that I want to learn,
Sure.
which is your biggest takeaway from educating the public, from helping them make their own decisions for them and their family. What is the biggest takeaway? What do we need to do to make sure that when someone says, I don't want this vaccine, they have learned and they have read everything to make themselves feel comfortable, and the people who want to go out and sign up with the independent pharmacies and go to Walgreens or CVS and go to their doctor and get it, they're making their best choice for their family. What do we need to do as a community here?
So I think as a community, you need to find a scientific source that is a trusted voice, an authentic voice that speaks to you in a way that you receive well. And I know we have many different, avenues of how we're receiving information, but find that scientific space that works for you. Maybe it's the CDC website. Maybe it's, anything. In particular, I would say that I do have Instagram, Twitter, LinkedIn at Dr. Jayne Morgan, DrJayne and I work to provide information in little 1-minute vignettes called the Stairwell Chronicles. And I will answer one COVID question each day and try to provide information. So find that trusted voice that works for you and then make your decision. We simply want to provide information to you.
Dr. Jayne Morgan, so you do a 1-minute explainer every day called the Stairwell Chronicle?
That's right.
Where do we find that?
And I do a series in Spanish as well.
Ah, hablas español.
Un poquito.
Oh, very good. We may need to do one of these in Spanish, you and I. That would be super fun
Yes,
to service our entire community. Then we can pick a different language, too. So you do that. So where can we find the Stairwell Chronicle?
So the Stairwell Chronicles on Instagram at Dr. Jayne Morgan, and they are there. Twitter, I'm beginning to populate, and also LinkedIn, they are there in full. You have to request, but I will accept you. Instagram, you can simply follow me.
Right.
You can look through the catalog that's already there and start to look at your questions. And I continue to update them periodically. But again, if you don't follow me, find someone where you
right?
feel that you are getting information, that you're not being coerced, but you're simply being provided the information.
And maybe get information that supports your gut and maybe goes against your gut, so then you can make an educated decision, right? That seems logical.
Great balance. Absolutely.
Again, Dr. Jayne Morgan with Piedmont, thank you so much. You're part of the Piedmont Task Force. We work with you guys at 6:30 p.m. on Tuesdays to present this half-hour special doing Channel 2 Action News at 6. I want to say goodbye to you right now. Thank you. I'm going to start following you so I can get the Stairwell Chronicle. And I'd love to go ahead and have you on and continue this conversation, because you are so wonderful and you've done such a great job at explaining at a very lay level, right? A very layman's terms level. So thank you so much, Dr. Jayne Morgan with Piedmont. Thank you, Dr. Jayne.
I appreciate it. Anytime.
You got it. And
Bye.
now, as we say goodbye to Dr. Jayne, I want to say thank you all for watching at this point. We've been at this since about 2 o'clock, and the goal right now is to educate you guys and let you guys make your own decisions and continue to answer your questions. That's why up here it says questions and answers. You have questions, we want to give you answers. Make sure to start watching Channel 2 Action News at 4, 5, and 6 today. Every day we're going to provide you with as much information, as much unbiased, as much scientific or not information that we can, because we want you to make decisions for you and your family. So thank you so much again. I'm Jorge Estevez. Don't forget to watch today at 6:30 p.m. on Channel 2 Action News at 6 for our half-hour vaccine special. Until then, follow us on WSBTV.com. We have a whole section on there, COVID-19. You can also follow us on Twitter and Facebook. And always download the WSBTV alerts. We will alert you whenever there's a news conference. There's going to be one later today with Governor Brian Kemp in the 4 o'clock hour. He's going to be talking about what we are thinking is expanding the vaccination requirements for people, or reducing them, I should say, at this point. So make sure you tune in for that. Thank you so much for trusting us with this information, and for the hundreds of you who've been watching and the hundreds of comments. Thank you so much. I'm Jorge Estevez. See you soon.